So many dedicated healthcare professionals end up exhausted, disconnected, and questioning the very system they devoted their lives to. Sometimes burnout isn't just about working too hard, it's about working in a way that's no longer aligned with your deepest values. Stay tuned to hear more about this important topic from my guest, Diane Gudmundsson. Welcome to Break Free from the Burnout. I'm your host, Dr. Anastasia Chopelas, physicist turned energy healer, and I'm here to help you make the quantum shifts to release hidden blocks to your success. Welcome to the show, Diane. I'm so happy you're here.
Thank you so much for having me.
Yeah, so you spent 25 years in traditional healthcare as a nurse and a nurse practitioner. What happened that made you realize that something important was missing?
Well, here's the thing, is I spent 25 years in many different environments and working really hard. And I had this very strong drive that kept me going, which was patient-centered care. And I got to the point where I had been through many different situations, many different clinics, because early in my career, I had the most incredible position. This is when I first started as a nurse practitioner, where patient-centered care was promoted. We had the most incredible leader. We had an environment that really encouraged community-centered care and patient-centered care. And it was just incredible. And so I was able to utilize things like community-centered care, population health principles, and all these amazing things that I had learned way back in nursing school. I felt so blessed to be able to apply these to that environment. And then things changed because leadership changed, the environment completely shifted. There was pressure to see more patients. There was micromanagement. There was a lack of support. And the system we had put together was started to fall apart. And so I spent the rest of probably the next decade looking for that again by going from environment to environment and having fun, having a great time initially, but realizing, okay, this isn't it. Go to the next one. Okay, this isn't it. And then I finally made the decision to walk away from the healthcare system and start something I called Nurse Practitioner on Wheels. I was able to start my own mobile clinic where I was able to provide the kind of care that I felt people deserved. I was able to spend the time with them and to listen and to be present for them and bring the care to them and listen to them. Hey, how do you want care provided? Instead of forcing them to come into a system that didn't work. And so I worked my butt off. I had other nurse practitioners working with me at that time, and it was a very powerful experience. However, I hit the point where I was visible. People were noticing me. I got the attention of the regulators and the government and different things because I'm in Manitoba, so it's a very different system here. And so a whole bunch of things came crashing down at once. The pandemic hit. I lost some staff, and I got to the point where it was like I was running 12 to 14-hour days. And even though I loved the work, it really did get to the point where it's like, okay, my body was telling me I just couldn't keep going, even though my brain was like, this is so much fun. Yeah. My body was like, no, you can't do this And so the next phase is very interesting as to what happened from there. But I'll just turn it over to you to give me your thoughts.
Yeah, so I completely agree. I think a lot of us that love what we're doing fall into the trap of, oh, I want to do more. This is so much fun. It's not work if it feels like this. But there's a time when you have to just let your body recuperate and rejuvenate from the constant demands of other people. So when you say patient-centered care, you mean that you focus on them rather than the system that just shuttles them through one by one, turning it into a business rather than care. Is that what
exactly it. And here's what happened is once I stepped away, I actually sold everything here in Manitoba, moved to Mexico for a couple of years, decided to do an MBA in healthcare leadership because I thought, okay, if I ever come back to healthcare, I want to come back in a different capacity so that I can make more of a difference.
Mhm.
And so here's where just by stepping away and gaining perspective and doing the healing work, then I was able to see things a little differently, right? I was able to just gain a new perspective, right? And part of what happened was I realized that healthcare leadership, because of I have multiple experiences, right? Because remember that example in my first job, that when you have an incredible leader, it ripples down to the
Yes.
staff because they're so excited and thrilled to do their job, and they're so empowered, encouraged, and lifted up, and you're able to tap into their strengths. And so the end result is the patients get the best care from that kind of team. And so this is what sent me on this path to focus on, hey, if we want patient-centered care, we have to have patient-centered leaders. And that's the only way. And it set me down this path to say, okay, how would I describe patient-centered leadership? And I thought at the very root of that is the concept that when you're looking after patients, there's a power differential, right? Because either you're the boss, or
Yes.
you're the doctor, or you're the nurse practitioner, and now we have somebody in front of you. So it could be a junior staff member on your team, it could be your patient in front of you, and there is clearly a power differential. And so how responsible we are with the power that we're given makes all the difference, because this is what I initially thought when I was a nurse. I had leadership positions, but I was trained from way back in my experiences and even my childhood that leadership meant authoritarian. It meant command and control. You have to be the boss, and you're supposed to know everything, and you're responsible for everybody, and you carry so much, and it becomes this
Yeah,
very heavy thing. And then you become like hard to work for, because seriously, who wants a leader like that? So I mean, I had to learn my own lessons. But this is what I realized, is that I got to the point where I was like, okay, when we're given the responsibility of power, no matter who we are, we could be a parent, we could be a doctor, we could be a CEO or a director or whatever. We have a responsibility to protect vulnerability when we're given that kind of responsibility. So that's
well,
what
yeah,
led me
it's
down
just
that
like
path.
right. And before, as a professor, I was responsible to help children, young adults get educated so they could become doctors or engineers or physicists. That was and I felt that responsibility, like I really want them to learn this so they can succeed, but that's nothing compared to a health outcome. So I can understand when
Mhm.
you have all of those people to be responsible for, what a burden of responsibility that is.
Right. And it's so easy to get carried away, because sometimes when you get put into positions of power, you feel it all depends on what your life has been like, right? So one of the taglines on the book I'm writing is called "The leaders we become reflect the lives that we've lived," right? So we become programmed and socialized and trained to lead people in a certain way, to be bossy, or like my experience, like I thought that leadership had to be that way.
Are you an
But
oldest child?
yes,
Me too.
so of course, right? So we learn it from way back, right? And every one of us has that, where we hold that power somewhere in our life, whether we're a healthcare provider, or we're a patient, or we're a teacher, or we're even a partner, right? Where one person has more influence and the other person has some degree of vulnerability. They don't have to be a vulnerable person per se, but there's a difference between the power that one person has compared to the other. So I call that the power differential. Like there's one has slightly more power than the other, right? So we have a responsibility to protect that vulnerability of that other person.
Yeah, I wish more
Yeah.
people would see it that way. That is a beautiful way to look at it, that when you have more power is to be more mindful of of having it and be more mindful of protecting the person with lesser. It's just like a mother-child relationship. We
Yeah.
have the responsibility to take care of them. So in my reading of some of you said that real healthcare begins with listening and connection. Why are those two things so powerful?
So here's the thing, right? So if you think about sitting in a doctor's office, right? So you're worried, you're definitely in the most vulnerable position, because how many of us want to be patients? Like nobody wants to be a patient, right?
Mhm.
But the healthcare provider is the one that has the knowledge, the authority, the influence. And so the question is, like, how is that used? And so if that practitioner rushes in and before even properly hearing your story, they have all the answers, well, it's you immediately become disempowered and you shrink and you become smaller. And like, but if that practitioner comes in and immediately slows down and then recognizes that, what we call that power differential, they recognize that you're in a vulnerable position and they pause and they truly listen and you feel seen, it transforms that connection, right?
Oh, it
And
absolutely
here's
does. The reason why I giggled is I had that exact experience where I just said a couple of things and the doctor came in and said, "I think you need an antidepressant." And I go, "You're not listening to me. I don't need an antidepressant and I won't take one. I won't take anything psychotropic. I need my brain to function. And I'm actually quite happy. It's just I don't have the energy." And so I just kept repeating myself until he got the point. But I've had this happen so many times. So people need, you really have to advocate for yourself if you're in a situation like that. And of course, he was the best endocrinologist in Las Vegas, where I was living at the time. So I didn't have much of a choice, but I eventually got him to come around and he gave me what I needed. And when I came back 3 months later and I was doing so much better, he goes, "Oh, it's so good we could help you."
oh,
So he took responsibility.
oh my gosh.
But I've had nothing but good luck here. I've had some really, I live in the Los Angeles area now. I've had some really tremendously good doctors that I'm very happy with.
But
Yeah.
see, you're somebody who is able to advocate for yourself.
Yes.
And so this is where I think it's really important. And I did a TED talk on listening from the patient's perspective. And there was young people that came up to me, and like young people who are in medical school, and said, "You need to teach this to you need to put this in our curriculum," right?
Yeah.
Because listening, and this is the way I look at it, is listening is not just a communication skill, but it's actually, if you think of it this way, listening is one of the ways that power differential starts to become safe.
Yes.
You see?
And
So
not
that's a
only
big
that,
thing.
but listening to I have a private healing practice, and most of my job is listening to see where they're going off because healing is spiritual, emotional, mental, and physical, and the emotional and the mental part play such big roles. So when you listen to where they're at emotionally and mentally, like what their thinking is, it leads to much better results. And I think that in healthcare, traditional healthcare, not just energy healing, but traditional healthcare, it's just as important.
Absolutely. And I actually chuckled because as I was writing about this in my book, I actually thought of a movie, and I thought of Spider-Man, because his father said to him, "With great power comes great responsibility." And it just struck me. I thought, that's it. And that's how
Yes.
I came up with this thing. It's like listening is the one of the ways that you can be responsible with your power. Like, it's such a big deal, right? And I could see this no matter where I was. And I've been operating in healthcare system for 25 years. I could see the difference between people that were heard and not heard, right? And it operates the same in your families, in schools, in communities, if you're leading groups, like any place where somebody has influence over another person.
Yeah.
Yeah.
And it's interesting because I grew up in a time where women, at least in my first 20 years, women didn't have a lot of what I want to say privileges. They couldn't have their own bank account if they were married. They there were many jobs they weren't allowed to do. So it's really interesting how things have shifted, but it used to be that as women, we were the ones that were in the inferior position. And it's interesting that both you and I are like, no, we have the power. We
But
have
once
the
you've been
power.
in vulnerable positions, and I have
Yeah.
been there as a patient, I've had some, I'm not going to get into all the details because I have many examples, even horrific birth experiences where I wasn't heard and I was going to be cut open without any anesthetic. There's a whole story around that I did put in my book because I thought, oh my God, that's a perfect example of being an inconvenience instead of actually listening to what I'm saying. And so that was extremely scary. Yeah.
Yeah, when I had that same experience when I was in a hospital in Germany, and because I strongly advocated for myself and I kept telling them this and this, and as I was checking out, they said, "We're gonna miss you, Frau Chopelas."
Oh, but I think that's really important to be able to stand up for yourself. And I think that's
Yes.
part of the way I help people. And I work with healthcare leaders, obviously, because we want we want patient-centered organizations and we want patient-centered leaders because that's what's going to give us patient-centered organizations.
Yes.
But
So you're in Canada, so is this
yes,
dripping into the US? Are you
yeah, yes. So it's not specific to Canadian healthcare because it's any system that has
Mhm.
where there's a leader, right? Because what I do is help people to understand themselves first because and that's why what I'm doing through a lot of my books and speaking and coaching and things like that is because when you understand yourself first, identity is the first step because knowing yourself and how you're
Yes.
operating and how you're making decisions and choices and your behaviors, it's all a reflection of your identity. And so working at that with that on a foundational level is part of what I do as well.
Yeah,
And
and once you know yourself, like for me, if people level a criticism at me, I can say, "Yes, that's true," or "No, that isn't," and not feel bad about it either way. Like, don't feel guilty about it, right?
so
So
so you
that
feel confident in yourself, who you are, and that's your identity,
yeah, and that's the
right?
identity, and that's important for leadership,
Mm-hmm.
right? To recognize other people, but also to recognize yourself, because if you keep getting knocked off the pedestal all the time by unfair or incorrect criticism, then you can't be an effective leader either.
Yeah, exactly. And
Yeah.
part of what we do is until we get to know ourselves and feel confident in who we are, is a lot of our old programming. And I'm sure you can identify with this, the old patterns that and being not enough and getting easily triggered and taking things personally, this all the kind of stuff, we can bring that into our work, right? And into our leadership. And so it can lead to people pleasing or over controlling or
Yes.
you can burn out very easily because you start to feel like you have to carry everybody's emotions and all this kind of stuff. So all those patterns, it's that's why it's so important to really understand yourself and get to know who you are underneath all of that
Yeah.
programming and all those old patterns.
Yeah.
Yeah.
Because my next question was going to be, so many of my listeners are healers, coaches, and wellness professionals who genuinely care about helping others, yet they're often exhausted. So, that burnout that you were just talking about. So, first of all, is recognizing who you are first. And that helps them restore their own energy so they can continue serving at a high level.
Right, because a lot of us, we're leading, whether it's we're leading our family, we're leading our teams, we're the leader in our business, we're
Right.
leading consults like you do with your healing. And so that comes with really, if you can understand yourself on a deeper level and have compassion instead of having the critical voice,
Mhm.
that is going to change everything because it allows you to lead whatever environment you're in, to lead with ease and flow and
Yeah.
a sense of self that you have that you it's becomes easy. It doesn't become where you feel like that the flashlight or the spotlight's always on you, like, oh, do I look good enough, or do I know enough yet, or am I responsible for this person's outcome and that kind of stuff. So the flashlight like the spotlight's on you when you're not fully healed. Whereas once you develop that deeper level of self-awareness and that sense of identity, you
Mhm.
can turn that spotlight and it really becomes about who you're working with. And your work becomes like a catalyst and a guide, and it becomes easy and with a flow. And that's where I am really a strong advocate for getting to know yourself on a deeper level so that you can have such a sense of self-awareness that it feels comfortable, that you're comfortable in accepting
Yeah,
with who you
so
are. Yeah.
yeah, I know this very well because I grew up with a highly critical parents, especially my mother. And after I left her, I had her voice in my head all the time, and I said, "Hey, wait a minute," and recognize. And so then I got to parent myself, where I said, if somebody came to me with the problem that I'm having or the issue that I'm having, what would I say? And that changed things for me, and it was like it almost flipped the script immediately, and so then instead of asking the question, "Why don't they like me?" It's like that's one of the thing is, "Why don't they like me?" Some people that are in caring for others want everybody to like them,
But
and
that's
I
because they have the spotlight on themselves. But as soon as you develop
exactly,
that sense of self-awareness and and certainty in your
exactly.
identity, that you're there to be a guide and a support and and like I always say, like a catalyst for that other person's transformation because they make their own choices, right? But you're
Exactly.
there to support and to listen and to guide, not to be responsible for the outcomes.
Yeah, and then so now it's like I people that are in that situation and they go, "Well, I want them to like me." And I go, "Well, do you like everybody?" And they go, "No." I said, "Well, why should everybody like you?"
Oh,
And yeah. So it kind of puts people at ease to not worry about what they're projecting. And the other thing that I say is if you don't behave the way you normally do, you're not your normal natural self, then people aren't gonna like the real you. They're gonna like something that you fabricated for them.
and then how do you then you burn out because how do you maintain that mask
Yeah,
right? Or that
it's
the
it's
way you think you should be, right?
exactly. So you end up spending all that energy. So that and so you probably encounter this too in the minority for women leadership in healthcare, for example.
Mhm.
Yeah.
Yeah, definitely, because there's a sense that you're more. It's more of a feeling of vulnerability,
Mhm.
right? Because you feel maybe at risk, or maybe more scared of judgment, or like you have to measure up to a certain standard, you know. But that again, that's just like putting a mask on,
Yes.
right?
And
Because then you
so
can't just be yourself. But if you do get comfortable in who you are and as yourself, then life becomes so much easier because you can just be yourself in every situation.
I agree. And so
Yeah.
I was just going to ask you what's the biggest lesson you've learned, and I think you just said it is
Authenticity and getting to know yourself. And that's one of the reasons why I really got into doing transformational coaching because that really digs down to the level of the identity. And then I incorporated hypnosis, right? And then I added human design as a sort of a trifecta of way of working with people because by combining those three modalities, it was like incredible how you could really get down to the root of a person, like down to the identity and the life purpose level of an individual.
yeah, I
Yeah.
found human design very fascinating because when somebody first introduced me to the idea, they gave me my design and I'm looking at it and I'm going, that's kind of funny. And all these people were saying, because we have an inner authority, right?
Hmm.
But I don't have one. I have no inner authority. And I go, everybody's saying they've got an authority, and it says I have no authority. And they go, yeah, you have to speak it out in order for you to decide. And I've done that since I was a little kid.
Yeah. So you decide based on your voice output. It's very
Yeah.
interesting,
So,
right? Yeah.
right. So I hear
Yeah.
it. As soon as I hear it, I go, okay, that's the answer.
Yeah.
And
It is.
I, so are you finding that people align, like when you work with human design, do you find that people align with their design based on,
Oh, it is. I have to tell you that I've been doing a lot of consults recently, And the people that have come to me, they just come to me with, oh my gosh, like, I'm not sure, like, why I have this tendency, or why I do this thing, or why this weird thing in my relationship. It's kind of a strange thing. And we really dig into it. And it's not just human design, it's more than that. But more often than not, they end up in tears with, I can't believe that I didn't realize this for the last decade. And it's transformed my life. Now I have something to go experiment with in my relationship to try this out now, because I can see how this affected my work relationships. This affected my relationship with my partner. It was causing conflict because I was operating out of the way I meant to communicate or things like that.
Yeah.
So it's
I
very
found that
powerful.
combination of that and the Myers-Briggs personality test, and then the DISC test gives people, each test gives you an insight into who you really are, because it asks questions like, when you're confronted with this situation, how do you react?
Yeah. And I was really into the personality test at one point. The Myers-Briggs saved the relationship with myself and my daughter. And the DISC really helped me to understand myself at a whole new level, especially when I was studying leadership. And then when I found human design, I realized that the other tests were so much more general. So I could, let's say, because I'm INTJ, for example, and now there's
So that's
probably,
Jay?
yeah, so there's hundreds of thousands of other INTJs in the world. And so really, how specific is that, right? Whereas human design, if you take the body chart and the codes and the lines and you really analyze somebody, there's only maybe 7 other people in the world that are similar to you. Like, that's how unique that system is. And that's why I fell in love with it. And so I really dug into it, and I've been studying it for the last 4 or 5 years.
If someone listening today feels burned
Mm-hmm.
out, disconnected from their purpose, or frustrated they aren't making the impact they want, what's the first step they can take this week to help them?
I would say just to really better understand yourself, like the way that you're wired to make decisions and to communicate with people and to relate to others, is go ahead and book a consult, because even just that one consultation, and it's in only 45 minutes, that awareness can really alter how you show up in every area of your life and change how you feel about yourself. And I experienced that myself, which is why I encourage people to do it.
Yeah. And so how
Yeah.
can someone find you?
And so basically, I'm on LinkedIn, and I also have a website, dianegudmundsson.com, where I can be found there. The easiest place to find me would be LinkedIn.
Yeah.
Mm-hmm.
So, yes, and I will put all of this in the show notes so people will be able to find you. They'll go to www.breakfreefromtheburnout.com, and your episode will be right there when it airs.
Okay, that sounds
Yeah.
good. And I also have a book for somebody, let's say if there's people who are healthcare leaders and they want to go a little bit deeper. Let's say they're healthcare professional, people leading teams, healthcare leaders. I do also have my book, Rooted to Rise, up for pre-sale. So it's also located at my website, and it's dianegudmundsson.com/RTR book. So it can
Oh,
also be found there, where I talk about patient-centered leadership and all of that. So yeah.
so when do you expect your book to come out?
I was hoping August, but I think probably more likely it'll be at the end of this year.
So, okay, awesome. Thank you so much for joining me on the show today. Your wisdom and your experiences can teach anybody, especially those of us that care and help others, to really take a first step toward relieving themselves of the stress, understanding their responsibility, and taking good care of themselves.
Exactly. And my mission is patient-centered care. But then when it comes to, especially women over 40, I have to say, is I just feel like I have a very strong passion and a sense of a very strong advocate to help women to really get to know themselves. And I've been through abusive relationships, and a lot of what gets lost in us is our sense of identity, specifically narcissistic style relationships.
Yes.
I've been there. And so regaining your
Ditto.
identity is a really big part of this, is rediscovering yourself and your true identity, because your sense of self gets lost somewhere along that experience. So I'm very passionate about that.
Yes, I can tell.
Yeah,
I
thank
really
you.
appreciate that. Yeah, because I think a number of us have been in abusive narcissistic relationships, and some of them are still
Mhm.
there. So reclaiming your
Yeah,
identity is really important.
yeah, it's a
Yeah.
big deal. So thank you so much for having me.
Oh, you're most welcome. Thank you for joining us on Break Free from the Burnout. Did today's program resonate with you? Give it a thumbs up or 5-star rating. Share with your friends and be sure to subscribe to my channel so you don't miss any future episodes. When you're ready to bring more harmony and alignment into your relationships, check out my free 5-step relationship healing protocol at scientifichealer.com/relationship. Resources and show notes are available at www.breakfreefromtheburnout.com. Until next time, I'm Dr. Anastasia Chopelas, sending you golden healing light and success vibes, becoming aligned, confident, and prosperous. Your gifts are so needed in this world.